Guaifenesin is used to treat coughs and congestion caused by the common cold, bronchitis, and other breathing illnesses. This product is usually not used for ongoing cough from smoking or long-term breathing problems unless directed by your doctor. Guaifenesin is an expectorant, which means it works by thinning and loosening mucus in the airways, clearing congestion, and making breathing easier. If you are self-treating with this medication, it is important to read the package instructions carefully before you start using this product to be sure it is right for you. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products are not recommended for use in children younger than 12 years. Ask your doctor or pharmacist for more details about using your product safely. These products do not cure or shorten the length of the common cold. To decrease the risk for side effects, carefully follow all dosage directions. Do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier or saline nose drop/spray. When taking this expectorant cough syrup, it's important to follow the instructions provided by your doctor. You can take it with or without food, usually every 4 hours. If you're using the liquid form, make sure to measure the dose using a special measuring device or spoon, and never use a household spoon. The dosage will depend on your age, medical condition, and how you respond to the treatment. Make sure not to take more than 6 doses in a day, and don't increase your dose or take it more often than directed. It's also important to drink plenty of fluids while taking this medication, as it can help break up mucus and clear congestion. If your cough is accompanied by a persistent headache, fever, severe sore throat, rash, or if it lasts, returns, or worsens after 7 days, be sure to consult your doctor as these may be signs of a serious medical issue. If you suspect a serious problem, seek medical help right away. If you experience nausea or vomiting, it's important to let your doctor or pharmacist know. Your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. While a severe allergic reaction is rare, seek immediate medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects, contact your doctor or pharmacist for advice. Before taking this medication, it's important to discuss any allergies with your doctor or pharmacist. This product may contain inactive ingredients that can cause allergic reactions, so it's best to talk to your pharmacist for more details. If you have a history of breathing problems, coughing with blood or large amounts of mucus, or conditions like diabetes or liver disease, it's important to let your doctor or pharmacist know before using this medication. Liquid forms of this product may contain sugar and/or alcohol, and the liquid forms and powder packets may contain aspartame, so it's important to use caution if you have certain medical conditions. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor, as it should only be used when clearly needed. It's also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown if guaifenesin passes into breast milk. And remember to inform your doctor or dentist about all the products you use before having surgery. When taking an expectorant cough syrup, it's important to be aware of any potential drug interactions. This means that the medication may interact with other medications you are taking, which could impact how they work or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including both prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor first. Guaifenesin, the active ingredient in expectorant cough syrup, can be found in both prescription and non-prescription products. It's important to check the labels of all your medications to ensure that you are not taking more than one product containing guaifenesin. Additionally, it's important to be aware that this medication may interfere with certain lab tests, such as urine levels of certain acids, potentially leading to false test results. Therefore, it's crucial to inform lab personnel and all your doctors that you are using this drug. As for the optimal timing and daily dosage, it's best to follow the instructions provided by your doctor or the medication label. Typically, expectorant cough syrup is taken at regular intervals as directed, and it's important to not exceed the recommended dosage. If someone has taken too much of this cough syrup and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. If your doctor has prescribed this medication, it is important that you do not share it with others. Remember to attend all of your medical and lab appointments while taking this medication. It is important to note that this medication is for temporary use only. Do not take this medication for more than 7 days unless your doctor specifically instructs you to do so. If your condition lasts longer than 7 days, be sure to inform your doctor. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When it comes to using expectorant cough syrup, it's important to store it at room temperature away from light and moisture. Avoid storing it in the bathroom and do not freeze the liquid forms of this medication. Different brands of this medication have different storage needs, so be sure to check the product package for specific instructions or ask your pharmacist for guidance. It's also crucial to keep all medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the medication when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of this medication. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.